A health profile on Uganda by the World Health Organization puts the number of maternal deaths at 4,700 and over 34,000 for infants annually. Many of these mothers and infants die as a result of complications from preterm births, labor-related complications, and severe infections which are preventable if mothers seek the services of trained medical personnel.
Some deliver from home for different reasons. The distances, the money. Some deliver from their homes. Others deliver from TBS. TBS still exists, and some mothers still believe in them. So we find that a number of some pregnant mothers also deliver from there. So that puts our percentage at 68%.
To increase demand for health services, Strides for Family Health, a USAID-funded project, rolled out a demand incentive strategy, Shoes for Health, to promote the uptake of these services. In partnership with Tom's Shoes Incorporation, USA, over 2 million pairs of shoes were distributed in Mpigi district to expectant mothers who come along with their husbands, those who completed the 4 antenatal visits, and those who had immunized their children.
Even the scanning services, they've really done something to improve on the turn-up, because mothers are scanned at the first visit and the 4th visit. And this has really helped us as midwives, especially working in the maternity department, because on admission you can really see that this one, they've noted this one has got like a problem like placenta previa, this one has got twins. Your intervention as midwife, your limits, when you need doctor's intervention, all this has been done by Strides.
If we are to compare the number of deliveries that we had before Strides came in, when you look at the financial 2007-2008, our deliveries from the health facilities stood at 33%. 2008-2009, 30%. 2009-2010, 34%. When we went to 2010 and 2011, that is when Strides came in with all these different strategies. The deliveries went up to 51%.
Mothers received relevant information on antenatal care, immunization, and nutrition. The distribution further targeted young children and teenagers who received age-appropriate reproductive health information.
These shoes for health, they were intended for mothers, expectant mothers at the 4th visit, postnatal mothers newly delivered, and those within 6 months after delivery, plus children who had got the 3rd dose of DPT.
For example, they were rewarding women who were immunizing. They were rewarding women who gave birth from the health facility because it was improving maternal and child health.
Obugata abantu bwabasanyusa nnyo kubanga baali tebalabangako omuntu ajja n'agabira abantu ng'ab'e mukyaleni nga tonga za bwereere era buli kiseera baba batubuuza abagaba obugata banaakomawo ddi.
To further sustain the created demand for health services, Strides for Family Health distributed a number of medical equipment to selected health centers in Mpigi district. These included scanners, surgical equipment, and gowns for expectant mothers. At Charlie Health Center 3, the midwife shows off the user-friendly delivery bed, baby cots, and other equipment to be used in delivery.
Eronga lino eryali lyakatandika nga terina byuma ate nga twali tetunamanya ddala source yabyo nga batugamba kozesa sente za PHC tugule ate sente tezimala olwedde n'okukola ebintu ebiriwo ng'ozitola kate tugule ebyuma nakyo kitukaluubiriza. Naye aba Strides bwe bayingirawo ne babituwa kyatuyamba nnyo era kiyamba nnyo community yaffe okubanga basobola okufuna ezo services ze twali tutasobola bbawa.
Now mothers are managed better. I can tell you, for example, that we are able to do right now up to 30 cesarean sections a month, while we were only able to do about 10 before Strides came.
As per now, many mothers, even from the neighboring districts like Wakiso, Butambala, Kalungu, They are utilizing our health services for maternal services because of the ultrasound machines.
The leadership and health personnel at the district are confident and optimistic to sustaining the demand for health services now that the Strides for Family Health project has come to a close.
We are proposing that each health facility that has a scan makes a contribution. We put that money into a pool, and then maybe 50,000 Uganda shillings, and we go collectively buy.
If the Ministry of Health takes up this project and it is owned by Ministry of Health and they cater for all whatever Strides has been catering for, I think the maternal and child health in Uganda will improve and will be sustained.
We have enjoyed working with Strides. They've made a difference within our indicators. We've seen the changes, we've seen the gains. There's been very good working relationships. They are always here. We move them to the field, we plan together, and as a district we think we've learned from them, but we think they have also learned from us. And we appreciate, we wish the project would be given another more chance.
With the improved uptake of health services, it is hoped that more lives of mothers and their children will be saved as efforts continue to be made towards complete elimination of maternal and child mortality.